Your robot therapist will see you now. Ethical implications of embodied artificial intelligence in psychiatry, psychology, and psychotherapy. The use of embodied AI tools in mental health practice raises various issues that must be addressed. One challenge is mental health practitioners' ethical responsibility to notify other treatment providers or authorities if a patient constitutes harm to themselves or others. It is unknown how this obligation would be managed in AI interventions if qualified people were not present to supervise. In the context of AI applications, the availability of suitable referral services and protections for at-risk individuals is also unknown, particularly for underserved communities. Another source of concern is the topic of patient autonomy. To minimize misconceptions, patients must thoroughly understand how AI programs or avatars work. Obtaining informed consent for AI applications used outside of medical systems can be difficult, especially for people who have cognitive disabilities or are unable to provide consent. If informed consent standards are not met, there is a possibility of manipulation or coercion. Therefore, the impact of AI on vulnerable populations should be carefully evaluated. The question of whether artificial intelligence can fully replicate the therapeutic encounter and address individual needs remains unanswered. According to certain studies, AI interventions may struggle with real-time emotional state evaluation or lack the human presence that users desire. Emotions can be transferred to AI gadgets, but the lack of a human therapist raises worries about how well robot therapists can handle such transference. Ethical concerns about algorithms utilized in AI applications are equally significant. Algorithms can be biased, perpetuating socioeconomic imbalances. To address these biases, AI systems must be transparent and scrutinized. However, communicating algorithms to individuals with impaired mental capacities necessitates careful thought. Long-term consequences on patients, the mental health community, and society should be investigated. Over-reliance on AI interventions may result in dependency, a shift in society ideals, or the deterioration of human-to-human relationships. The effects on identity, agency, and self-consciousness must also be investigated. When addressing AI applications in sensitive domains such as sex robots, specific considerations arise. The issues of objectification, reinforcement of social inequality, and potential harm must be thoroughly investigated. When examining the larger biopsychosocial knowledge of mental disease, reductionism in mental health care should be avoided. Perceptions of embodied AI are shaped by cultural and historical settings, and faith in medical practice can suffer as a result. Understanding cultural understandings of technology is critical, as is preserving trust between patients and doctors. Finally, engagement with embodied AI begs the question of what it means to be human. Relationships with AI gadgets modify behaviors and worldviews, and issues, such as attachments to intelligent robots, may occur. To fully grasp the advantages and potential dangers of embodied AI in mental health, additional strong research, including randomized controlled trials, is required. Despite the fact that this is a new topic, it is critical to consider the ethical implications and draw preliminary conclusions and recommendations.